Thank you very much, Bev. As Bev mentioned, North Country Matters is a local video news magazine. It's now in its 16th year. Over the course of each season, we've looked at many of the issues that rural New Yorkers face and struggle with every day. In 2017, we did a show about the ALICE project. ALICE stands for Asset Limited, Income Constrained, Employed. This project was initiated by the United Way of Northern New Jersey several years ago to bring focus to the families and individuals who work, but whose salaries do not provide sufficient resources to meet basic needs. Other states have since adopted this model and methodology, including New York. The report acts as a bridge between the Great Recession of 2008 and 09 and the economic meltdown we're experiencing right now in New York as a result of the coronavirus. Slide 29. A typical ALICE family struggles to meet 5 basic household necessities: housing, childcare, food, transportation, and healthcare. They are the working poor. Many of the ALICE barriers are really societal problems, like too many low-wage jobs, rural transportation limitations, and the lack of quality, affordable childcare. Yet in America, society tends to blame individuals because they can't make ends meet in their own lives. The ALICE report gives a county-by-county snapshot of just how people struggle in our rural counties. Sadly, the economic problems of rural New York can't be solved by equal pay alone. Low-wage jobs tend to ensure low wages for all the workers, regardless of gender, societal, or educational background. Slide number 30, please. Of all the 62 counties in New York, 24 are classified as rural, and many of the others have significant rural spaces within them. Mostly they tend to clump together geographically in certain areas around the state, and rural counties were already stretched thin to provide the supplemental help that many of these ALICE families needed before the current crisis. Living wage jobs are out of reach for too many New Yorkers. 90% of the jobs in New York State pay less than $32,000 a year, according to the Albany-based New York Association of Training and Employment Professionals. Slide 31, please. Before the coronavirus shut down much of the economy, a recent Brookings Institute report found that 53 million Americans between the ages of 18 and 64 accounted for 44% of all workers who qualify as low wage. A majority of these workers are adults in their prime working years, and the low wage work they do is their primary way of supporting themselves and their families. Women, people of color, and those with low levels of education are the most likely to stay in those low wage jobs. The ALICE report that points out that many families are just one crisis away from economic disaster. That economic disaster is here, and it is affecting nearly everyone. In early March, 1/5 of all jobs had already been affected by the coronavirus emergency, and much of that impact has been at the low wage end of the scale. In short, many women have no resources to weather any crisis, especially the dramatic loss of income from this pandemic. Here in New York State, the Department of Labor announced more than 80.5 thousand unemployment claims were filed just last week, the first week in which the claims were impacted by the virus. This is an increase over the past year of 520%, and initial claims for unemployment insurance increased by a minimum of 284% in each of New York's 10 labor markets. Slide 32, please. American society is finally facing the consequences of the lack of living wage jobs, sick pay, and health care, which are critical benefits in a public health crisis like this. New York and the federal government are starting to grapple with this lack, although there is much work yet to be done to make it fair and cover every employment sector. And yet, we see some hope. Even with the widespread layoffs in every sector not considered essential, there are job postings in those essential businesses. Some traditional low-wage employers have opened their wallets and are paying out bonuses to their employees in these difficult times, offering higher wages, and many are hiring. Will these higher wages last? Although some of these employers claim these wages are temporary to meet the current emergency, It will be hard to roll them back now the genie is out of the bottle. What we have seen in states like New York and a handful of others is a strengthening of the social safety net that is happening quickly on a variety of fronts. These include eliminating any waiting period for unemployment benefits, opening back up state-based healthcare systems for the newly uninsured have lost their health coverage along with their jobs, and setting up emergency sick days here in New York to be followed, we are told, by a permanent system in the state budget this year. There's also now a widespread understanding that childcare is an essential service and a driver of the economy, particularly for workers in healthcare and other essential occupations. The last thing our overburdened healthcare workers need is to struggle to find safe and adequate childcare as they perform their critical duties during this pandemic. Slide 33. As Albert Einstein once said, in the midst of difficulty lies opportunity. Rural folks are good at making something out of very little, and new business models are being created daily that take into account the needs for social distancing and no physical location. Relocalizing the economy may be another positive outcome of the pandemic. Essential services are local services, and people who can find ways to meet a local need are well on their way toward creating a new income stream. Home-based or cottage industries are springing up all over, but we must remember, as Elisa just pointed out, that we need to make sure that the grants and the other supports are going to businesses like that, not just the brick and mortar businesses. The current public health crisis is having the positive effect of bringing national attention to the inequities of our current economic system. States like New York are moving quickly to address these inequities. Our job will be to see that these solutions become permanent for everyone. Thank you.